There was one presentation here at the 2025 MaRS Health Impact event that completely blew my mind. It was so informative, so fascinating, and the panelists each had a very unique perspective. I wish it could have gone on for 3 hours instead of just 45 minutes. What was it? Well, watch to find out. Let's get to it. Hello, Colin Hung here in Toronto, Ontario at the 2025 MaRS Impact Health event. This event is held inside the lovely MaRS Discovery District, which is a building here in the heart of downtown Toronto. It is located at the junction of Hospital Row and the Ontario Legislation Building. MaRS fittingly sits right between the government that pays for healthcare and the organizations that provide healthcare. Now, I did get a free media pass from MaRS to attend this event. Thank you very much. But they have not had any input into this video and have no idea what I'm about to say. The Impact Health event happens annually and is designed to showcase innovations in digital health, medical devices, and biotech. This event attracts a wide range of companies including pre-seed, seed, and in-revenue organizations. It also attracts early-stage healthcare angel investors and the ecosystem of partners that supports startups. I'm not 100% sure if the organizers of this event did it on purpose, but earlier this same week was the Bloom Burton Healthcare Investor Conference, and that event attracts later-stage healthcare companies. So if you went to both of these conferences this week, like I did, you could really get a sense of where innovation is happening in healthcare in Canada, and you could really see the difference between the two types of companies looking for funding. On one hand, here you had people looking for 25 to 100K, and there you had people looking for 10 to 100 million. There were many bioscience, life science, medical device, and digital health companies that presented here at MaRS. I only attended the pitches from the medical device companies and the digital health ones, mostly because life science and bioscience pretty much goes over my head. Now, from the pitches I did listen to, there were several companies that stood out to me. Ciba Health, which uses wearables to help with chronic conditions, had impressive revenue and customer implementations from around the world. Able Innovations talked about the growth they had in customer traction and the new interest that they are receiving for their patient transfer platform. Kidney Labs showed off their dialysis machine that does not require gallons of ultra-purified water. They also win for having the best name for a company. O'Farrell Medical had a really cool device that improves EP catheter contact stability, which improves outcomes for arterial fibrillation treatment. And finally, I really enjoyed hearing from a company called Head First, which uses a saliva test to objectively assess for a concussion. Now, full disclosure, through my work at Venture Lab and Innovation Factory, which are two nonprofit incubators here in the region, I have advised both Able Innovations and Head First. But none of those organizations have had any input into this video and no money has changed hands. But what was that presentation that completely blew me away? Well, it was a panel on medical misinformation that featured Dr. Eileen de Villa, former medical officer of health at the City of Toronto, and people here in the region know Dr. de Villa as the steady voice during COVID. She is a local healthcare celebrity, even though she is too humble to admit that. Also on the panel was Sunika Patel, and she is the Health and Learning Lead at YouTube Canada. Part of her job is to help the company navigate the murky waters of medical content on YouTube. Justin Ling is an investigative journalist with strong opinions. And lastly, the moderator, Ivan Semniak. He is a science reporter for the Globe and Mail and has been there for over a decade. Now, these 4 panelists explored medical information from multiple angles, including its rise, why it's so effective, the unique demographics of those who accept medical misinformation, the root causes of it, and, of course, how we can combat it. Here are just a few of the comments that I took note of from this fantastic panel. I'm going to read them from my notes. We need to defund those that weaponize misinformation. The real problem is overconfidence. This, not a lack of education, is the root of why people go down the misinformation rabbit hole. They are overconfident in their own knowledge and do not trust outside authorities. Trust today is no longer dependent on credentials. It's about how well you can connect with your audience. Misinformation mongers do this better than science and medical professionals do. For the most part, science and medicine are doing a good job at putting credible information out there. But it's the 7 to 25% of those who have no or low trust in institutions that are the real challenge. The question we need to ask ourselves is, what trauma caused this erosion of trust? Maybe we can start there. And finally, we used to be in a news and expertise scarcity environment. Now we have an overabundance of both. Too much news from too many people claiming to be experts. This session was one of the best panels I have attended all year. And Gita Nayar, if you're watching this, I was thinking about your book on misinformation the entire time I was in this session. Now finally, I want to give a shout out to the event organizers. This is the only conference that I have been to where the box lunches are healthy and delicious. Seriously, I have never had a salmon sandwich that tasted as good as the one I had here. And it was paired so well with a little cup of grilled vegetables and a couscous salad. Kudos for the great catering and the great planning for this event. A fantastic agenda. I'm Colin Hung here in Toronto, Ontario at the MaRS Impact Health event. Thanks for watching this, and I'll catch you on the next episode.